David Humphrey from Boulder, Colorado. Why are we willing to leave such a legacy of debt to our future generations to deal with?
That's a great question. And if the political paralysis that we have sets in, look, our budget, which we use CBO scoring, pays this debt off. Under our budget, according to CBO, the debt peaks in 2 years at 74.5% of GDP, and then it goes steadily down thereon after. We believe that it's important to do that. It's all about confidence and trajectory. Trajectory that the debt's not getting out of control, that the debt is going down, and confidence that we're doing the right things to do that. And that doesn't mean artificial spending caps and controls, actually changing the law that shows that spending is getting under control and then enforcing it with artificial spending caps and controls. To me, that's what it's all about at the end of the day. And I really fundamentally believe if we did something like this, we would have economic growth and prosperity, because we would know that America is preempting a debt crisis, that America is getting ahead of this problem before it starts tackling us. If we wait, if we allow these meta-scare tactics to continue, seep in, demagogue, and inflict political paralysis in our system, then we're going to have a debt crisis. And you know what happens then, Maria? Austerity, cuts to current seniors, cuts to people who depend on the safety net, tax increases that slow down your economy. The people who get hurt the first and the worst are the people who need government the most, the elderly and the poor. That's what we're trying to prevent. And so our spending is more targeted toward those populations. That's why we always say, fix welfare for people who need it, end welfare for people who don't need it. That's corporate welfare, that's spending on corporations, on the connected, and through the tax code. So I really believe we have to make a decision about our values. Who should be helped the most by government and who shouldn't? We think we should help those who are least among us. And the sooner you do this, the more we do it on our terms, the more gradual and sensible our reforms are, and the more we procrastinate, the deeper the hole we dig, the more painful and immediate the solutions must become.
Talk to us a bit more about how you envision governors taking over their own parts of the Medicare issue. Medicare data, this is from the audience, Medicare data shows where the health market works effectively. Could the Medicare program highlight the best markets?
Absolutely. Medicare Advantage is showing this. We've learned a lot through Medicare Advantage and the Medicare Drug Benefit Program, where you have better market competition. And not all states are the same. So I've talked to several governors who asked us to block grant Medicaid because they believe they can make the program work better at a better price, at a better cost, if they can have more control over flexibility in reforming it in their states. I've talked to Mitch Daniels, Chris Christie, Scott Walker, several governors who are saying, give us the freedom and the flexibility to customize these programs because we'll make them work better. Right now, we're having problems with this program. On Medicare, it kind of comes down to this. Mind you, it's the biggest driver of our debt in the future. It's got tens of trillions of dollars of unfunded liabilities. Everybody acknowledges that. The status quo is the enemy of Medicare. It's actually the worst thing because that means collapse. And so does the money go to the government and come down through price controls and ration care, where we have a board of 15 people make all of these decisions? Or does the money go through the individual? More for the poor, more for the sick, less for the wealthy, and give them power in a marketplace to have competition. Do you want a centrally planned system, or do you want a system where the providers, doctors, hospital, insurance companies compete against each other for our business? Now, to make that work, you got to make sure that the person is powerful. They have money and they have rights. You got to clean up our insurance laws. Under our Medicare reform proposals, Medicare does the negotiating with insurance companies. Medicare sets up guaranteed coverage options from which seniors choose, and then Medicare subsidizes those based on need. That, to me, is a far better way to go. It's just like the system I have as a member of Congress and federal employees have. It's just like the way that Medicare drug benefit works, which came in 41% below cost. Medicare has a lot of experience doing this way, and we just fundamentally think it's a better way to go because it gives us the ability to guarantee that the benefits system, as it's now designed, is there for people who now rely on it. That, to me, is a better way to go, a patient-centered system where the patient has the power versus a government-centered planned system where you necessarily have to ration and control prices. Price controls don't work. We've tried them many times before. They produce lots of inefficiencies throughout the system and scarcities, and I just don't think we want to go down that road.
But according to health statisticians, 1/4 of Medicare patients account for 85% of the program's total costs. Many of these patients are receiving end-of-life care. So how will your health plan reduce the cost of treating these very sick people?
Well, so as I mentioned before, our health plan, it's a budget, and the budget resolution is broad architecture, and this isn't final legislation. Those are kinds of details that would be worked out, I would think. But in a concept level, you're right about those statistics. You want to have that decision not made by some board, not made indiscriminately by government. That is the decision that should be made by the beneficiary, their family, and their physician. And you want that decision to be made with all the information. And so when Pete Peterson's facing that moment, I think Pete Peterson should pay more for his benefit because he's a man of means, and other people of means should be making those decisions. Those who are least among us should have more coverage and support. Those who have more should pay more. And in those kinds of situations, there will be price exposure, and so they'll be discussing these things as families. This is an inherently personal thing. And the dignity of the human person is such an important overriding principle that we employ to these solutions. And the last thing I think we should do is have some kind of arbitrary board determine these things. This is something that should be left to the individual, the family, and the physician, and they should make a decision based on all the surrounding factors. And so I just think if you're going into an area the government shouldn't go to, if you try to just put some one-size-fits-all formula at end-of-care life issues.
Are there any other items that you want to ensure that the people understand are critical to getting the deficit down eventually to a surplus situation?
I'll make a political statement, and then I'll make a policy statement. From a policy perspective, the sooner we deal with this, the better off we are as a country. GAO told us 2 years ago our unfunded liabilities, meaning the promises government's making to Americans that it doesn't have any money to pay, was $62.9 trillion. A year ago, they said it was $76.4 trillion. This year, they're telling us our unfunded liabilities are $99.4 trillion. Every year we stop trying to fix this problem, it gets that much worse, and the inevitable solution is that much more painful. Politics. I'm very worried, and it's pretty clear these days, that, and both parties do this to each other, that whenever you put out a reform plan to try and fix this problem, the other party uses it as a political weapon against you. And what they do, in this particular case with Medicare, they're shamelessly demagoguing and distorting this. We call it Medi-scare, to try and scare seniors. The irony of this is our plan actually preserves the benefit for current seniors, but trying to scare seniors and turning these things into political weapons, what that ends up doing is just inflicting political paralysis. That means nothing gets done. And that means we go farther down the path of debt. So the politics of this means we need leaders, leadership. What do leaders do? Leaders offer and propose solutions. We have not had that from our partners on the other side of the aisle. We've had press releases, we've had TV campaigns and speeches. We have yet to see an actual solution using real numbers that add up to fix this problem. And in divided government, and I do believe ultimately this will have to be bipartisan, but you can't have negotiations with just yourself. You need to have responsible leaders put ideas on the table. The president created a fiscal commission, which I was happy to serve on. He disavowed the fiscal commission. We put dozens of the recommendations in our budget. Then he gave us a budget which didn't fix the problem. Then he gave us a speech which still didn't fix the problem. And now we have another commission, the Biden commission. We can commission ourselves to death. We just got to get out there and fix the problem. And I think leaders should put solutions out there that actually fix the problem. And then let's debate with each other about how best to fix the problem and compromise. You can't get to that point if you have political demagoguery. So my fear is political campaign strategies for 2012 have now seeped into 2011, and we're going back to our respective corners and we're fighting this out politically. With the debt limit, my hope is that we get a serious down payment on this issue. We get a serious down payment on spending and debt to buy us more time and space in the credit markets. And then if there are things that we just simply can't agree upon, I would like to think we could have a civil conversation based on fact about how best to solve this country's problems. The country deserves this kind of a debate. People are hungry for solutions. And I got to tell you, Maria, representing a district that voted for Bill Clinton, Dukakis, Gore, and Obama, I believe people are ahead of the political class. They're sick of the demagoguery. They're sick of the meta-scare campaigns. They want solutions. They want answers, and they're way ahead of us, and I think they just deserve nothing less.
And we're going to talk with Gene Sperling momentarily. Is there anything that you would like to say before we hear from Gene Sperling about the president's plan?
That's a softball-loaded question, I guess. No, I'm just kidding.
What is wrong with the president's plan? We're going to bring Gene Sperling out right now.
What is wrong with the president's plan is it doesn't fix the problem. The problem is a debt crisis. It doesn't do anything to address the drivers of our debt, our entitlement programs. Where they do something, which is the IPAB, I just personally believe that putting a board in charge of these things is the wrong way to go. Even with all the tax increases in the president's plan, which I think will chill economic growth, it still chases higher spending, and it doesn't even come close to fixing the problem. My personal opinion, if you're going to put up a budget, it better be a budget that solves our problem, that gets our debt under control. We've done that. Nobody else has.
Congressman Ryan, thank you very much.
Thank you, Maria. Appreciate it.